I can't hold on. My hands are too cold.
I'm slipping.
Hold on.
I'm slipping.
I can't get up. Here, I'll push you out. I got you. Hold on.
The shop owner notices something is wrong and immediately calls the police. Officers quickly arrive at the lakeside. They fight with all their strength to rescue two children lying on the ice.
Give me your hand. Give me your hand. Come on, I got you.
Thank you.
Okay.
But another child, named John, has already sunk to the bottom of the lake. Soon, rescue divers arrive with specialized equipment. The two men plunge into the freezing water. They search the lake bed with their tools, but after more than 10 minutes, they find nothing. Just as one of the men begins to feel hopeless, he hears a voice.
Go back!
Thinking it is his captain calling out to him, he quickly moves in that direction. Sure enough, he manages to pull John up.
Just look up, Tommy. Pull him up. We got him. Pull him up.
We got him!
I'm losing my grip.
We got him!
By then, 20 minutes have already passed since John fell into the water. John is rushed onto an ambulance. Although he has no vital signs, the doctors still perform emergency resuscitation. When John's mother gets the news, she rushes to the hospital. Overwhelmed with grief, she can barely remember how to drive. John is taken into the emergency room. After a series of life-saving efforts, John is pronounced dead. The attending doctor delivers the devastating news to John's mother, who has just arrived. Staring at her son lying on the bed, she cannot believe that the boy who spoke to her just 30 minutes ago is now gone. She gently touches her child's ice-cold body. Her mind drifts back to the moment she first brought him home.
God. Please, Jesus. Please, Jesus. My John. Holy Spirit, I need you now. Please don't take my son. Please bring life back into John. Please, God. Come, breathe life into John, please, God, send your Holy Spirit to save my son!
Just as her words fall silent, the child who had long lost his heartbeat suddenly shows a pulse. The doctors rush to check him. Even they can hardly believe what they are seeing.
Send your Holy Spirit to save my son!
Just as her words leave her mouth, the son who had long lost his heartbeat suddenly shows a pulse. The doctor rushes to check him, and even he finds it hard to believe. He immediately calls for a helicopter and transfers John to a top-tier hospital for further treatment. The mother is overjoyed, believing her son can be saved. But after examining him, the doctors there tell her the truth. Although her child is still alive, his pulse is extremely weak. After 20 minutes without oxygen to the brain, even if he wakes up, he will suffer severe brain damage. And there is a strong chance he may not survive the night. They advise her to have the rest of the family come, but the mother cannot accept this. She begs the doctors not to give up on her son. The doctor who previously treated John returns home. After his daughter learns about what happened to John, she lies in bed late at night, crying nonstop. Because the two of them are classmates. The doctor writes the case down because in all his years of practice, John coming back from the dead is nothing short of a miracle. Soon the night passes. John, who had already been issued a death notice by his attending physician, miraculously survives the most critical period. Doctors and nurses alike are stunned that he pulls through. At the same time, the media begins racing to report the miracle that happened to John. People everywhere silently pray for him. But while John's mother is in the restroom, she accidentally overhears a conversation between two doctors.
It is neurologically impossible for the patient to change course at this point.
Be that as it may, our job is to meet the needs of the patient until Dr. Garrett changes course or the patient expires.
This makes her furious. She storms up and shouts at them.
And my son is right in front of you. And my son can hear you whether you believe it or not. So, from now on, I don't want anybody saying anything negative about his prognosis in this room. We will all speak life over John. Do I make myself clear?
Mrs. Smith, we really didn't mean to upset.
I said, do I make myself clear?
Yes.
Great.
As a mother, no matter what her child's real condition is, she cannot tolerate anyone speaking ill of her child.
I can't hold on. My hands are too cold.
I'm slipping.
Hold on.
I'm slipping.
I can't get up. Here, I'll push you out. I got you. Hold on.
The mother holds her son's hand, murmuring how much she misses him and talking about things he used to love. Suddenly, she feels his hand squeeze back. She is overwhelmed with excitement. She quickly calls the priest over to confirm it. After several questions, there is no response at all. But when the priest mentions a basketball star, John's hand actually moves. It turns out the mother was not imagining it. The two of them immediately call in the attending physician for further tests. If this is real, it would be a miracle. But no matter what questions the doctor asks, John shows no reaction. At this point, one of the observing doctors says the earlier movement may have just been a normal muscle spasm. That night, all of John's relatives come to see him. This deeply moves his parents. The mother plans to thank everyone for coming, but instead, she overhears several relatives talking, which once again angers her.
We came here to be supportive, honey, and there's nothing left for us to do here, so we need to
wanna
not
stay
overstay our
longer.
welcome. We need to go, okay?
Girls, look, we need to be prepared for the fact that John is probably not going to make it, okay? I really don't think you want to be here for that. I know I don't, so...
Mrs. J, are you okay? Can I have your attention? Just down that hall, do you know that John is fighting for his life? Okay? And so in this room, there is no negative talk of any kind. Nothing. Okay? Thank you.
The next morning, the father comes to the hospital and finds that his wife cannot be woken up. He panics and calls the doctors right away. After an examination, they discover that after days without sleep, combined with a relapse of her diabetes, the mother has collapsed. The doctors force her to rest, warning that they will remove her from the hospital if she doesn't. But her son is lying upstairs, his life still hanging in the balance. How could she possibly sleep? So she sits there from daylight until nightfall. At that moment, the priest comes to comfort her, but the mother says that looking at her son in the hospital bed, she feels completely powerless and helpless. Overwhelmed and unable to breathe, she climbs up to the rooftop to get some air. She has never bowed her head to anyone in her life, never begged anyone for anything, but for the first time, she gives in. She looks up at the sky and cries out,
I'm sorry. I'm a broken, desperate, a woman full of pride. But I get it. I have to let him go. I know you love me. Whatever you have for John, for Brian, for me, I surrender. I surrender.
Excuse me?
Wake John up, take him off of everything, and let our son fight for his life. You just said these things that he's on are making him worse. And even if John wakes up, we know he'll probably never live a normal life.
Oh, that's right.
Okay. So we wake him up.
The son's condition continues to worsen. He develops a persistent fever of 104 degrees that won't come down. The cause is a medication used to keep patients calm. This drug puts